Hello, and thank you very much for watching this video about research questions and qualitative and quantitative research. So one of the first steps you need to take when embarking on a research project or a literature review is defining your research question. So what is a research question and what, importantly, makes a good research question? As usual, rather than giving you prepackaged answers, I will encourage you to use your critical thinking. But let's start by reminding ourselves that having a clear research question is incredibly important, because if we think about the research project as a house that you're building, the research question is like the foundations of that house. Everything that you will do in your project or review stems from your research question. Many times when you read papers, the research question is written as an aim instead. In most cases, the aim of a project is the same as the research question, just without the question mark. For example, in a study aiming to describe registered nurses' experiences of working in critical care while pregnant, the research question would be, what are the experiences of registered nurses who are working in critical care while pregnant? And when reading papers, usually you find the research question or aim at the very end of the background or introduction section, just before the methods section. So let's make an example to understand how to write a research question. Usually you start from a topic that you're interested in, something that has piqued your interest. So let's make an example here. You are reading about a new research program called Surgeryfitness. And this is a program that has been designed for patients to undertake prior to surgery. And so you want to know whether undertaking that program will lead to better outcome for patients. So first of all, you need to ask yourself, what or who is the focus? Yeah, patients who need to undergo surgery. Okay, but hang on a second, which patients? All patients will have an operation, or maybe you want to focus on a specific surgery type or a specific age range or a specific disease. That's up to you, but you always need to ask yourself why you would be interested in one patient group as opposed to another one. What is the setting and context? That's another important question. Is the exercise program delivered in hospital? Is it delivered online? And finally, what do you really want to know? Yes, you want to know if this exercise program works, okay? But which outcomes are you interested in? When we talk about outcomes or outcome measures in research, we mean the particular effect we are measuring when another variable changes. So is our outcome patient mortality? Is it the length of stay in hospital after their operation? Or is it whether they are readmitted after a few weeks because they're unwell? Again, that will really depend on your focus. If the specific surgery you're focusing on is at very low risk of mortality, then looking at whether this exercise program reduces the risk of patients dying during or shortly after surgery might not be a meaningful endeavor. So let's assume we've made up our mind and we've thought critically about all those aspects. What will our final research question look like? Might be something like, what is the effectiveness of the research program Surgeryfitness on length of stay of patients with obesity who undergo bariatric surgery, for example? And let's also consider a not so specific question. For example, does Surgeryfitness work? Or what is the impact of Surgeryfitness? So why are these not great questions? Because while you have specified what you're interested in, so the exercise program, you have not specified what it is that you're interested in specifically about that program. Does it work? Yes. But does it work to improve what? So which outcome, again, do we want to target? And does the program work for whom? So who are the patients that we're interested in? What surgery in this case they're going through? And sometimes, remember, it's really okay to have broader questions. Actually, most of the times, you will start thinking about your question more broadly before refining it. But at some point, you will have to narrow it down to make it an answerable question, exactly in the same way as if you think about going on a quest. When you start, it is okay to start broadly and say, for example, I want to find out which is the best art gallery. But at some point, you will need to decide which type of art gallery you're interested in. Is it modern art only? And what does best look like? Is it the gallery with the largest number of paintings or the one with the largest number of paintings from famous artists like Van Gogh? Are you looking for the best gallery in the world or in your country, in your town? So this is just to reassure you and to say, don't be afraid of starting broad, but then think about the main focus, the setting or context, and what it is that you're really interested into. Let's now have a look at what type of research might be better to answer your question, qualitative or quantitative. Well, we also need to have a quick look at the differences between qualitative and quantitative research. In quantitative research, the aim of the researcher is usually to understand relationships between things by measuring them. For example, a researcher might be interested in knowing whether offering a mindfulness-based therapy to caregivers of patients with dementia decreases the caregiver's anxiety levels. The best way for them to know whether there are any changes in anxiety levels is to measure the caregiver's anxiety levels before the mindfulness program and after. To do that, a researcher would measure the anxiety levels with a tool, a scale, or something that allows caregivers to give a score of their anxiety. A very simplistic way of describing quantitative research is that it deals with numbers, but be very careful because it's not really the main focus of quantitative research. While it's true that a lot of quantitative research deals with numbers and statistics, the main aspect of quantitative research, the main feature, is that it tries to measure something and to establish relationships between the things that the study measures. Also, sometimes the study might be aiming in measuring something, say, for example, how many pressure ulcers were recorded in a hospital over 5 years, and the profiles of people developing pressure ulcers in terms of age, gender, multimorbidities, and so on, but without actually looking for relationships between the different things that they measure. So, for example, without looking for a relationship between age and pressure ulcers. That is also possible in quantitative research. With qualitative research, the focus is not so much on measuring, but on a deeper understanding of people's experiences, usually through talking with them or asking them to fill in diary entries or open-ended questions on surveys. For example, a researcher might be interested in understanding the experience of people who had a stroke during hospital-to-home transitional care. The best way to understand this is to actually talk to these people and ask about their experiences, or asking them to fill in a diary from the day they are discharged to some days after they're being discharged home. Another method used in qualitative research is getting people to talk to each other about something, and this is called a focus group. For example, if you were interested in understanding what student nurses think is missing from their courses when it comes to teaching skills, rather than interviewing many students separately, you could put them in a small group and ask them to share their experiences and reflections. There are many qualitative methods and designs out there, but what they all have in common is that they aim to explore an experience or a concept rather than measuring it. And now I want just to make an example, a final example, to show you how the same topic actually could be looked at both with quantitative and qualitative research, depending on how you specify your research question. So let's go back to our previous research question of the surgery fitness program. So the question, as we asked, so the effectiveness of the surgery fitness program on the length of stay of patients who undergo bariatric surgery, patients with obesity who undergo bariatric surgery, that question would be best answered by a quantitative study where the length of stay of patients who participate in the program is measured and then compared against the length of stay of those patients who do not participate in the training program. They would have to be similar patients, so also patients with obesity who undergo the same surgery, so bariatric surgery, and we will compare the two. So that would be a quantitative study. If instead we were interested in understanding what patients who participated in the Surgeryfitness program felt, what they liked, what they disliked, what they think needs changing, then the best option would be a qualitative study where they can be interviewed or asked to join a focus group and discuss these aspects together. I hope this helps you to see how your research question really shapes the methods that you use afterwards. The topic or broad question might be the same. So in this case, is surgery fitness a good intervention? But the specific research question can take you down 2 or more very different avenues. Thank you for watching.